What if some of the screening tests recommended automatically after you turn 70 actually deserve a real conversation with your doctor before you do them? I know, it might surprise you, but what I've learned over years of caring for my older patients is that sometimes searching too hard can create more problems than it solves. Hello, I'm Dr. Gabriel Costa, physician specialized in senior health. On this channel, I share what I learned day after day caring for people your age. If you want to keep getting content like this, please subscribe, and a thumbs up really helps us reach more people who need this information. What I'm going to share with you today isn't a rejection of preventive medicine. It's a call for medicine that's more thoughtful, more adapted to who you actually are after 70. I'm going to walk you through 5 screening tests that really deserve a conversation with your doctor. I'll explain why, and most importantly, I'm going to give you the smarter alternatives and the warning signs you should never ignore. The first test I want to talk about is the full-body CT scan. You've probably seen the advertisements in private clinics promising a complete picture of your body to catch anything before you even have symptoms. The reality is very different. What I see regularly in my practice are people in perfect health who get one of these scans and discover incidentalomas. That's just a medical term for accidental findings. A small spot on the liver, a cyst in the kidneys, a tiny nodule in the lungs. The vast majority of the time, these discoveries mean absolutely nothing. But here's the trap. Once something is found, everything accelerates. You walk out with a report that says indeterminate lesion. Those 2 words become a source of real anxiety. And then the cascade begins. The finding creates worry. The worry leads to more invasive tests. And sometimes you end up with procedures that were never necessary in the first place. The research is striking here. 86% of healthy adults over 70 in perfect health who get a full-body CT scan find something. 86%. And if that scan uses a certain type of imaging, you're exposed to radiation equivalent to hundreds of chest x-rays. Radiation accumulates in your body. Why take that risk if the benefit isn't clear? So what do we do instead to make sure everything is actually okay? The answer is comprehensive geriatric assessment. This isn't just a simple checkup. It's a real in-depth conversation with a doctor who understands how the body ages. Instead of chasing shadows on a picture, we focus on what actually matters. Your independence, your strength, your ability to move. We evaluate something called frailty. And I want to be clear, that's not an insult. It's a vital medical concept. We measure how fast you walk, how strong your grip is. These markers predict your health future far better than any image. We review every single medication you're taking. It's incredibly common to see older adults on 10 medications or more, and sometimes the dizziness or confusion isn't a new disease. It's a side effect from one of those medications. We look at your daily habits, your nutrition, your sleep, your physical activity. These are the real foundations of prevention. This assessment doesn't create anxiety, it gives you power. The second test is a brain MRI for mild memory lapses. I see this constantly. A 75 or 80-year-old person comes in because they forgot an actor's name or why they walked upstairs. The normal little memory gaps that come with age, but the fear of Alzheimer's disease is so strong that the family demands an MRI. Listen carefully here, getting an MRI in this situation is almost always a mistake. Many of my patients arrive with worried adult children concerned about completely normal memory lapses. But once you've had the scan, you see what the radiologist writes. Mild diffuse cortical atrophy related to age, scattered white matter changes. To a doctor who knows the subject, that report just describes a normal 78-year-old brain. But to the person reading it, it sounds like a death sentence, and from that day forward, everything changes. The MRI didn't give them a diagnosis, it stole their confidence. Here's the statistic that changes everything. In studies of people over 75 with perfectly normal thinking and memory, 94% of brain MRIs show what radiologists call abnormal findings. 94%. The problem is that these images often have nothing to do with how your mind actually works. So what's the smart way to evaluate your memory? The most valuable tool is a simple 10-minute cognitive test right in my office. Tests like the Mini-Cog or the Mo-CA. If the test comes back normal, you can reassure your family. If the test shows a concern, we don't stop there. We start hunting for the real culprits. First, we review your medications. This is the main suspect. Sleep medications, anxiety drugs, they can all create mental fog. We run blood tests to check your vitamin B12 and how your thyroid is working. These are classic causes and easy to fix. We evaluate your mood. Depression in older adults often shows up as memory problems. We check your sleep quality. Sleep apnea is a seriously underestimated cause of cognitive issues. Now, something important. The small everyday memory lapses, forgetting why you walked into a room, forgetting someone's name but remembering it later. This is normal after 50. But if you notice bigger changes, things that get in the way of your daily life, patterns that are getting worse over time, or if people close to you are noticing changes too, talk to your primary care doctor. They can do simple evaluations that help distinguish normal aging from something that deserves more attention. The earlier we catch real concerns, the more we can do about them. The third test is routine cardiac stress testing, putting a healthy person over 70 with no chest pain and no shortness of breath on a treadmill because the protocol says so. What strikes me is seeing patients who climb 2 flights of stairs without trouble, who walk an hour every day, and then we put them on a treadmill because it's in the guidelines. The problem is that stress testing has a very high false positive rate in older adults. It can show an abnormal result for dozens of reasons that have nothing to do with a dangerous blockage. But once you get a questionable result, you move to cardiac catheterization. That's an invasive procedure. What often happens is the person who came in walking out leaves with a cardiac patient label, a stack of new medications, and most of all, fear of exercise. They stop their activities. The test that was supposed to protect them robbed them of their quality of life. So what's the alternative? First, listen to your body. Your best stress test is your daily life. If you can climb 2 flights of stairs, if you walk at a good pace, if you garden without chest pain or shortness of breath, you're passing your stress test every single day. Now, and this is important, if you feel chest pain when you exert yourself, if you get shortness of breath that seems out of proportion, if you have palpitations that last, then absolutely talk to your doctor without waiting. Those are signals that deserve evaluation. If we want to assess your future risk more precisely, there's a much more modern and safer tool, the coronary calcium score. It's a simple, low-radiation CT scan with no injection that takes 5 minutes. It measures how much calcium is in your artery walls. A score of 0 means very low risk. A high number tells us you should focus on prevention. My advice is this: don't let anyone put you on a treadmill just by protocol. Trust what your body tells you in your everyday life. And here's something else that matters. If you're taking medications for your heart or your blood pressure, don't stop them or change them on your own. Talk to your primary care doctor first. These medications are there to protect you, and they work best when used as prescribed. If you ever notice chest discomfort that's new, pressure in your chest with activity, shortness of breath that worries you, or unusual fatigue, don't wait. Speak to your doctor right away. These are signals worth taking seriously. The fourth test is routine colonoscopy after 75 or 80 if your previous screenings were normal. I want to be very clear, I'm not against colonoscopy. I recommend it without hesitation starting at 45 or 50. The problem appears when we apply this same thinking to very old people. In medicine, we always have to weigh the benefit against the risk, and in an 80-year-old, the scale tips toward risk. In my office, I often see patients in their 80s whose last colonoscopy 10 years ago was completely normal and the system sends them a reminder. But at your age, you really have to think about whether the benefits outweigh the risks. The preparation is grueling. Liters of laxative that keep you at the toilet all night, leaving you weak and dehydrated. For someone your age, that's already a risk. Then there's the sedation, which carries more risk in older adults. But the risk we worry about most is bowel perforation. As you age, your colon wall gets thinner. The risk of tearing, while still small, doubles or triples after 75, and a perforation needs major surgery, often with a permanent colostomy. For an 80-year-old, that can mean the end of independence. What's the benefit of doing the exam? Preventing cellular changes that, if they developed, would take 5 to 10 years to cause a problem. The major medical guidelines already suggest stopping routine screening somewhere between 75 and 85. It's more likely that the colonoscopy will harm you than help you if your life expectancy is less than 10 years. Of course, this isn't for everyone. If you have a family history of issues, if you had polyps in the past, that's a different story. So what do we do instead? We shift from invasive searching to intelligent vigilance. First, pay attention to your symptoms. You need to see your doctor right away if you notice a persistent change in your bowel habits, blood in your stool, belly pain that lasts, or unexplained weight loss. If you notice something new and persistent, don't chalk it up to age. Talk to your primary care doctor. The sooner we address things, the better. Second, active prevention through what you eat. The secret to a healthy colon is fiber: fruits, vegetables, legumes, whole grains. Fiber feeds your good bacteria, which produce protective substances. My message is simple: get colonoscopies at the right time. Until 75, it's vital. After that, for most people, it's time to focus on watching for symptoms and the power of what you put on your plate. And now we come to the fifth and final test. This one is for men, and it's one of the most debated topics in medicine. The PSA blood test, prostate-specific antigen, to detect serious prostate conditions, especially after 75. PSA was sold as a great promise. The trouble is that using PSA without thinking has created an epidemic of overdiagnosis and overtreatment. What I see in my practice and what genuinely concerns me is the number of 80-year-old men who discover slow-growing cellular changes in their prostate, something that would never have caused them a single problem, and who end up with heavy treatments and permanent side effects. PSA can rise for dozens of reasons: inflammation, a urinary infection, even cycling. For every man helped by PSA screening, we estimate about 50 others are diagnosed and treated unnecessarily with permanent consequences. The real problem is overdiagnosis and overtreatment. What specialists are increasingly discussing is the need for a shared, informed decision rather than automatic screening. We're moving away from routine screening toward an honest conversation between you and your doctor. Your doctor needs to explain the pros and cons clearly, with actual numbers, and then you decide what matters most to you. I'm not saying throw PSA away. I'm saying talk to your doctor about it, understand what it really means, and decide together what makes sense for you at your age. For men diagnosed with low-risk cellular changes, the alternative to treatment is active surveillance. This isn't doing nothing. It's a structured follow-up to make sure nothing becomes more concerning. And of course, we focus on real symptoms: difficulty urinating, blood in the urine, bone pain. Yes, that deserves investigation at any age. Do you see the common thread running through everything I've just explained? It's not a rejection of medicine. It's a call for wiser medicine, more personalized, more human. Medicine that understands that the goal isn't just living longer, it's living better, with quality, with independence, with joy. The 5 tests I've discussed, the full-body CT scan, the brain MRI for mild memory lapses, the routine stress test, the automatic colonoscopy after 75, and routine PSA screening in older men, they all have something in common. The risk of harming you often outweighs the potential benefit when they're applied automatically without thinking about your personal situation. Real prevention isn't a battery of tests hunting for shadows. It's a partnership with your primary care doctor. It's assessment focused on what you can actually do every day. It's a commitment to a healthy lifestyle. Whether you're a man or a woman, whether you're watching this for yourself or for someone you love, my goal isn't to make you afraid of medicine. It's the opposite. It's to help you become active in your own health. Ask questions. Understand why each test is recommended. Be brave enough to ask your doctor, does this exam really make sense for me at my age, in my situation? Health isn't a report with no abnormalities. Health is playing with your grandchildren, enjoying a walk, keeping your mind sharp and your heart light. And sometimes the most courageous and healthy decision you can make is saying no to an unnecessary test. If this content has been helpful, please subscribe to the channel so you don't miss the next videos. A thumbs up really does help us reach more people who need this information. And in the comments, tell me, have you ever felt pushed to get a test that didn't feel necessary? I'd love to hear from you. Take care of yourself with discernment. The content shared here is educational and does not replace medical consultation. Dr. Gabriel Costa is an artificial intelligence educational character created to make senior health information accessible to a broad audience. Before making any decisions about your health, please talk with your primary care physician or a qualified healthcare professional. Thank you for being here with me. See you very soon.